Hello everyone. Today we're going to discuss about the RA 7875, or also known as the National Health Insurance Act of 1995. The National Health Insurance Act was enacted to implement Section 11, Article 13 of the 1987 Constitution, which mandates the state to adopt an integrated and comprehensive approach to health development and to make essential goods, health and other social services available to all the people at affordable cost, with priority for the needs of the underprivileged, sick, elderly, disabled, women, and children, and provide free medical care to paupers. The National Health Insurance Program is a social insurance program intended to answer for utilization or purchase of health services by covered beneficiaries. Consisted initially of Programs 1 and 2 of the Medicare. The National Health Insurance Program will be expanded progressively to constitute one universal health insurance program for the entire population. Being a social insurance, the health insurance program is prohibited from A. Providing direct healthcare, B. Owning or investing in healthcare facilities, C. Buying and dispensing drugs and pharmaceuticals, and D. Employing physicians and other professionals for the purpose of directly rendering care. All citizens of the Philippines are covered by this program. Coverage is compulsory. Therefore, all citizens are required to enroll in the National Health Insurance Program. However, the compulsory coverage in certain provinces and cities cannot be affected until the Philippine Health Corporation, or the PhilHealth, is able to ensure that members in such localities have reasonable access to adequate and acceptable health care services. To be entitled to the benefits, the beneficiary must be enrolled with this program in accordance with the following policies. A. Persons currently eligible for benefits under Medicare Program 1, including SSS and GSIS members, retirees, pensioners and their dependents, are automatically enrolled in the program. B. Persons eligible for benefits as members of local health insurance plans established by the PhilHealth are also deemed enrolled in the program. C. Persons eligible for benefits under health insurance plans established by local governments as part of the Program 2 of Medicare, including indigent members, should be enrolled in the program. And D. Persons eligible for benefits as members of other government-initiated health insurance programs, community-based healthcare organizations, cooperatives, or private non-profit health insurance plans should be enrolled in the program upon accreditation by the PhilHealth. Individually paying members should enroll for membership through the offices of the Philippine Health Insurance Corporation. A member who is separated from employment may continue his membership by enrolling as an individually paying member within 3 months after separation. Otherwise, the benefit entitlement will be suspended. To register with this program, the appropriate PhilHealth membership registration form, together with any of the following documents, must be submitted. A. Birth certificate. B. Baptismal certificate. C. GSIS or SSS member's ID. D. Passport. And E. Any other valid ID or document acceptable to the Philippine Health Insurance Corporation. Registrants who are declaring dependents should submit the following supporting documents, whichever is applicable. For dependent spouse, we have marriage contract. For dependent legitimate children, we have marriage contract and birth or baptismal certificate. For illegitimate children, we have birth or baptismal certificate. For dependent adopted children, we have adoption papers or court resolution or decision. For dependent parents, we have birth or baptismal certificate of registrant. For dependent stepchildren, we have marriage contract of the parent and stepfather or stepmother and birth certificate of the dependent stepchildren. And lastly, the duly notarized joint affidavit of two disinterested persons and other relevant information attesting to the fact of the relationship of the dependents to the supposed members. And also we have certificate from the DSWD or barangay captain attesting to the fact of the relationship of the dependents to the supposed members. And lastly, we have any other valid ID or document acceptable to the Philippine Health Insurance Corporation. The Health Insurance ID card. Upon enrollment, the PhilHealth, through its local office, shall issue a health insurance ID which shall be used for purposes of identification, eligibility verification, and utilization recording. Members of the National Health Insurance Program are obliged to pay the premiums in accordance with the following guidelines. A. Employees and their employers shall pay monthly contributions as determined by the PhilHealth, the amount of which shall not exceed 3% of the monthly salaries. B. Self-employed members shall pay their contributions based primarily on household earnings and assets, but their total contributions for 1 year shall not exceed 3% of their estimated actual net income for the preceding year. C. Contributions made in behalf of indigent members shall not exceed the minimum contributions set for employed members.
Premium contributions for individually paying members, it shall be at a minimum of 75 pesos per month and can be paid quarterly, semi-annually, or annually. Persons not obliged to pay premium contributions. A. Retirees and pensioners of the SSS and GSIS prior to the effectivity of the National Health Insurance Act. B. Members who reach the age of retirement as provided for by law and have paid at least 120 monthly contributions. C. Enrolled indigents. Premium contributions for indigent members. It shall be subsidized partially by the LGU where the member resides. The PhilHealth shall provide counterpart financing equal to the local government's subsidy for indigents. In the case of 4th, 5th, and 6th class municipalities, the national government shall provide up to 90% of the subsidy for indigents until such time that they shall have been upgraded to 1st, 2nd, or 3rd class municipalities. Benefits under this program. There are various benefits under this program. First is the inpatient hospital care that consists of room and board, services of healthcare professionals, diagnostic, laboratory, and other medical examination services, use of surgical or medical equipment and facilities, prescription drugs and biologicals, inpatient education packages. As for outpatient care, there is services of healthcare professionals, diagnostic, laboratory, and other medical examination services, personal preventive services, prescription drugs and biological. There is also emergency and transfer services and other healthcare services. These are the following health services not covered by the National Health Insurance Program. A. Non-prescription drugs and devices. B. Alcohol abuse or dependency treatment. C. Cosmetic surgery. D. Optometric services. E. Fifth and subsequent normal obstetrical deliveries. F. Cost-ineffective procedures shall be defined by PhilHealth. G. Outpatient psychotherapy and counseling for mental disorders. H. Home and rehabilitation services. These are the conditions for entitlement to the benefits. First, he must suffer illness or injury which requires treatment as inpatient or outpatient in an accredited healthcare institution. Second, he must show that he contributes with sufficient regularity. And third, he must not be currently subject to the penal sanctions under the law. These are the following grounds for denial or reduction of claims. Over or under utilization of services, unnecessary diagnostics and therapeutic procedures and intervention, irrational medication and prescriptions, fraud, gross unjustified deviations from currently accepted standards of practice and or treatment protocols, inappropriate referral practices, use of fake, adulterated, or misbranded pharmaceuticals or unregistered drugs, use of drugs other than those recognized by the PNDF and those granted exemptions by the board. Compensability of confinement for less than 24 hours. Hospital confinement of less than 24 hours are not compensable except in the following instances. When the patient died, when the patient is transferred to another healthcare institution, or in emergency cases. The Philippine Health Insurance Corporation. The PhilHealth is a tax-exempt government corporation attached to the DOH for policy coordination and guidance. Basically, it administers the National Health Insurance Program. The PhilHealth is vested not only with administrative powers but also quasi-judicial powers, to conduct investigations for the determination of a question, controversy, complaint, or unresolved grievances and render decisions, orders, or resolutions. To summon parties to a controversy, issue subpoenas, or requiring the attendance and testimony of witnesses, or the production of documents and other materials necessary to a just determination of the case. To suspend temporarily, revoke permanently, or restore the accreditation of a healthcare provider or the right to benefits of a member, and or impose fines after due notice and hearing.